So my name is Austin Marks and I'm a respiratory therapist. I've been in RT for about 2.5 years now. On my YouTube channel I mainly talk about respiratory therapy. I do have a few other videos mentioning a few other things. If you want to check that out, that'd be awesome. If you like what you see, make sure you like and subscribe. I'm also the admin of a Facebook group called the RT Club. And on this Facebook group it's full of respiratory therapists, respiratory therapy students, and we kind of talk everything respiratory therapy. So whether it has to do with new things happening in the field, something that you came across, maybe you want to mention something going on within school, go ahead and ask it there. We're all here to support each other and it's a fantastic group. So this is a question that I get asked pretty frequently, and it's, hey Austin, what job or jobs can I have throughout RT school or maybe before RT school when I'm starting my prerequisites that'll really help me out with school or help me when I'm a therapist? So a lot of times I like to tell them anything in the hospital really. So whether that's like a medical assistant or like an MA, a CNA, a certified nursing assistant, an ER tech, an EKG tech, anything in the hospital really that's getting you personal or patient care experience, that's giving you that one-on-one time. Plus if you can learn something while having that patient care experience, that's just icing on the cake. So for example, an EKG tech. So as an RT you need to know anything that's going on within an EKG. So if the heart is doing something crazy, what's it doing? Why is it doing that? You need to know that. That is on your boards, plus it's great to know in the hospital in an emergency situation. You want to become an ER tech. Okay, RTs are always down the ER. Like I said, I work in a trauma bay as well as in the ER. So you're an ER tech, you get the rhythm of the ER, you know how things flow, you know the protocols and all the other good stuff. And then when you're actually a respiratory therapist down the ER dealing with these patients, you know how things flow. You're not going to be down there for the first time trying to figure things out. Because now as an RT you have a little bit more responsibility than that ER tech. So therefore, that ER tech position set you up to be that RT. Another huge benefit when it comes to working some of these jobs in the hospital is a lot of hospitals offer tuition reimbursement. So I went to school with several people who worked in the hospital. One was an ER tech, one was a CNA, two different hospitals, and both of their hospitals paid a huge chunk of their tuition for them to go to school and become a respiratory therapist. Now, they did have to go ahead and join back with these hospitals as an RT and work for them for some amount of time. However, a lot of their school was paid for and they basically went to school for nothing. So if you ask me, that's totally worth it because school is expensive as heck. Now some jobs that I highly suggest that you don't get before you go to RT school is, let's say you go to school and you get a whole nother degree. So let's say you won't become a nurse or you become a physical therapist. Why would you go to school and do all that stuff unless you absolutely hate being a nurse, absolutely hate being a physical therapist, to go back to school and be an RT? School is a lot of money, it's a lot of time, so why would you want to do that? Decide what you want to do beforehand. I tell people all the time that you need to shadow. So I highly suggest that you figure out what you want to do before you go to school and pay thousands of dollars to become that thing. So that's one of the reasons I started this YouTube channel, so people can understand what respiratory therapy is and what we do. So I do have plenty of videos on respiratory therapy, including a day in the life, as well as many other different things. I highly suggest you check those out. If you like what you see, make sure you like and subscribe. It really helps me out a lot. Well, anyway, if you have any questions about anything respiratory related, or maybe some of these jobs relating to respiratory therapy or working in the hospital, make sure you leave a comment below and I'll make sure to get back to you. Anyway, I hope you enjoyed this video and see you in the next one.